Hello, and welcome to this Foster Care Institute online training webinar Anger Management: How to Parent a Child with Anger Challenges. I'm your host of this webinar, the founder and director of the Foster Care Institute. I am a consultant for law firms and legal agencies and foster care agencies across the nation, as well as a trainer, author, and most importantly, a foster and adoptive parent myself. Our goal during this webinar is to increase awareness of why children in foster care might have anger behavior challenges and how to help stop this behavior. During this online training webinar, participants will increase their awareness of why a child in foster care might have anger and the reasons behind this behavior, and gain an understanding of how to develop and implement strategies designed to best provide support and help to foster parents as they care for children with anger management issues. Take a close look at that child in that picture there. Has that child lived in your home? Has a child with that look on his face been a part of your family? Have you had someone with anger management issues placed in your home? Most likely, if you have been a foster parent for some time, you have had a child look very similar in your home. But why is that? What causes anger in children? Let's examine. Now, as you well know, when a child is placed into foster care, it is a time of tremendous stress and anxiety. Indeed, we cover this in other online training webinars at the Foster Care Institute and the book, The Foster Care Survival Guide. I want you to imagine a 7-year-old child, much like a child in the book, A Different Home, a new foster child story. A child who's removed while in school by a caseworker, by a stranger, if you will, and placed in a home with other strangers, foster parents. This child never has a chance to say goodbye to her parents. This child never has an opportunity to gather her belongings. Instead, she's removed from school and placed in a foster home. She is confused. She is scared. She is afraid. She is lonely. Or perhaps a child who has been removed from her home late at night by a caseworker and perhaps even law enforcement. Removed from her mother and her father, removed perhaps from her siblings, taken from her stuffed animals, her bed, her house, her home, her toys, her pets, taken from her neighborhood, her aunts and uncles, cousins, grandparents, relatives, taken from schools and teachers and playmates, maybe even church, taken from all she knows, placed into a strange home with strange people suddenly without any explanation whatsoever, and told that this is her new family. What does that child do? She asks questions such as, why am I here? When do I go home? When do I see my mom and dad next? Is it my fault? Oftentimes, she cries herself to sleep. Being placed into foster care is a time of tremendous trauma and anxiety. Put aside all of the abuse, the neglect, the harm that child may have faced before being removed from that environment, before being removed from that situation, and before being placed into foster care. Put that all aside. Simply being placed into a foster home is a time of tremendous anxiety. It is a time of tremendous stress. This type of stress can play a very important factor in the lives of children in foster care. This type of stress and anxiety may lead to bouts of tantrums and displays of anger as a child struggles mightily to process the many emotions that are swirling within her, trying to process the fact that she is not living with her family, trying to process the fact that she's living with strangers, trying to process all the confusion that's abounding within her. This type of process often leads to tantrums and displays of anger. For youth in foster care, the anxieties and stress they feel from going from school to school to school, from one placement to another placement, from visitations with parents who may be upset, confused, angry, visitations where parents never show, going to court case after court case, counseling session after counseling session, therapy to therapy. This type of situation may also result in lashing out from that child and displays of anger. Is it any wonder? Is it any wonder that a child in foster care may have that tantrum, may have that emotional meltdown, may be angry? This anger, these displays of tantrums and outbursts and meltdowns, so many times comes from the stress of being placed into foster care. Many youth in foster care have suffered some sort of abuse before being placed in your home. They may lash out and display anger as a release from the pain they are feeling or the memories of the pain that was inflicted upon them in the past. It is important to keep this in mind. As we go forward in this webinar, the anger these children display the majority of the time has nothing to do with you as a foster parent. It results from the stress. It results from the anxieties. It results from this type of abuse. It results from neglect and trauma. As a child suffers from neglect and trauma, many children may struggle with their feelings and anxieties as they do not feel safe. You see, as they live in an environment that's full of trauma, full of abuse, they live in an environment where they have been neglected, they simply do not feel safe. This lack of safety in their life can lead to anger. There are those children who may become angry simply to get your attention. You see, these children they crave the attention of an adult, of a caregiver, of a parental figure. They crave that because they've never received in their life. So they lash out. They have that meltdown. They display anger in order to get your attention, even if your attention is displayed in a negative fashion, even if you are punishing the child, even if you are frustrated with the child, even if you are upset with the child. They simply crave your attention however they can get it. And sometimes they do that by displaying anger, simply for you to turn around and acknowledge their presence. Some children may have issues with anger management due to the great difficulty in processing and understanding the sensory information from their environment, from their surroundings. Remember, they're in a new environment. They are surrounded by new experiences. Sometimes this can be so overwhelming to them that it could lead to an outburst and an emotional meltdown. As you know from a previous online training webinar here at the Foster Care Institute, children in foster care sometimes have what is known as ADHD, and we go into that in great detail on that webinar, as well as the book, The Foster Care Survival Guide. For more information, please check out that webinar and that book for information on ADHD and other disorders and anxieties. Many children with this disorder, ADHD, especially those who are hypersensitive or impulsive, have trouble controlling their behavior. These children who are struggling to control their behavior and have been diagnosed with ADHD may have difficulty following instructions. And you can imagine this can be a very difficult time in the classroom, in a learning environment, in a school setting. They have difficulty following instructions and transferring from one activity to another. And as they struggle with this, they often appear angry, they appear frustrated, because indeed they are frustrated, and they appear defiant. Now, autism in a child may trigger emotional meltdowns as well. You see, the lack of consistency, the lack of any type of structure or any sort of routine whatsoever, this may cause a child to feel unsafe. And you well know, as a foster parent, that many children are placed into foster care coming from an environment where there was no structure, there was no routine, there was no consistency. This often results in a child becoming overwhelmed, and they trigger an emotional meltdown. Sometimes children with autism can become overwhelmed by stimulation from their environment, and this also results in emotional meltdown. As you well know from the book Helping Foster Children in School, children in foster care are generally a year and a half behind academically. As they go from one school to another school to another school, they fall further and further behind in their schoolwork, in their academics, in their learning. Many children are not placed in the proper learning environment. They're not getting the educational resources that they need because they're being hopped from one school to another school. Is it any wonder? Is it any wonder that children in foster care, by the time they age out of the system, 55% of these children will drop out of school? So many children who are struggling with this, as they go from school to school to school, many times they fall through the cracks, so to speak, and these children end up with undiagnosed learning problems. As they struggle in the classroom with learning and from moving from school to school, they may release this stress and frustration in some sort of angry display. Sadly, far too many children in foster care have had poor role models in their life before being placed in a foster home. Perhaps their older siblings, perhaps their relatives, aunts, uncles, grandparents, cousins, and even perhaps their parents may have struggled with anger, may have had their own anger management problems. Children often mimic what they see and are taught. For these type of children who have been living in an environment that is full of anger, they simply copy what they have seen. There are those children who become angry towards another in an attempt to fight back or to get back at someone who has picked on them, who has bullied them, or hurt them in some way. And children in foster care are often easy targets for their peers in school. They are the vulnerable ones, and they oftentimes are bullied. Some of these children will fight back, and they will become angry to get back at that bully. So, how does a foster parent feel when the child is in their home, placed in their home full of anger, yelling, arguing, screaming, having meltdowns, having tantrums, being defiant? How might that foster parent feel? Perhaps they feel exhausted. Perhaps they feel frustrated with the situation. Perhaps they're just simply confused as to why the child is always angry. Again, let's look at this picture here. As a foster parent, has this been you in the past? Has this been you recently? Is this you right now? Are you struggling with a child who has anger management in your home? And if so, is it exhausting you? Is it frustrating? Is it confusing? Is it all three? So, what do you do? For the child who already has issues of trust and attachment, and so many children in foster care do have issues of trust and attachment, how you address a child who has issues of anger and already has issues of trust and attachment, this can be a very difficult and tricky process. To be sure, there's some things you should not do. You should not offer a harsh punishment, because this harsh punishment may push that child away from you. This harsh punishment of yours may alienate the child from you. Indeed, there may be times where you just want to sit that child down and give that child a lecture, or you might want to engage in the argument or the debate with that child that they're having with you at the moment. Save that for something else. Keep this in mind. Many children in foster care, before coming to live with you, before being placed in a foster care setting, have never had any sort of moral upbringing or have a different value system than the foster parent does. When that child is screaming, when that child is having an emotional meltdown in the middle of the grocery aisle, when that child is having a tantrum on a Sunday morning during church, when that child is screaming as you're trying to take the child to school in the morning, when that child is being openly defiant to you, remain calm. Yes, it may be difficult. Yelling and shouting at a child who is having an outburst is not going to help the situation at all. For you see, that child may have always been yelled at before moving to your home and joining your family. So you need to remain calm and try to discuss the problem calmly. Yes, this might mean you have to count to 10 or 20. This might mean you have to have some deep breaths. This might mean you need to leave the room for a few moments to collect your thoughts and become calm. This might even mean you need to ask your spouse or your partner to handle this particular problem. And that's okay. As a foster parent, you should never use any form of corporal punishment on a child at any time. Foster parents are not permitted to spank a child at any time. Do not threaten corporal punishment or a spanking or mouth being washed out with soap or whatever it may be as a form of discipline. Even the simple suggestion of it could place you at great risk. When a child is angry or having that meltdown, take a moment to reflect. Take a moment to think about what is behind this action. Is a child having this emotional reaction, this anger, this emotional meltdown, this tantrum? Is it related to some sort of learning disorder? Are they being overloaded with their sensory? Is this sensory related? Do they have a history of abuse themselves before coming to live with you? Do they crave your attention? What might the reason be behind their anger? Remember, most likely it has nothing to do with you. After taking time to examine why the child may have been angry, remind that child that you care for him, that you love him, and that you're here for him. Remember, he may never have heard these words of comfort, these words of care, and these words of love before being placed in your home. These might be alien words to him. He needs to hear from you that you care for him. If a child is having a tantrum or a meltdown, do not give in to that child. If you give in this time, she will expect you to give in the next time. She will know that the one way to get your attention is with this type of action. If she's having that meltdown in the middle of the grocery aisle because she can't have a certain type of cereal or candy, whatever it may be, do not give in to her. simply to quiet her up, simply because she's so loud and you are embarrassed. Do not give in. When she's having that emotional meltdown in the middle of a church on a Sunday morning and you want to quiet her up and give in to her, don't. Stand firm. Remind the child that there are better ways and alternatives to obtain what she wants. If you give in to the child, she will know this. She has won. And her type of behavior results in getting what she wants. And she will do it again and again and again. It may be difficult. It may be awfully difficult. But do not give in to the child. Now, when you become frustrated, when you become assertive or even angry yourself, you lose control of the situation. Instead, let the child know that you are in control of the situation and that you know what's best for him. This will help to de escalate the situation and keep all safe from harm. As we noted earlier, if you need to take that time out or walk away to take control, do so. It's okay to do so. Ignoring the behavior can be difficult. It may seem mean to ignore the behavior. It may be very challenging to ignore the behavior. Yet sometimes ignoring the behavior is the best sort of management. So you see, when you ignore the child's behavior, when you ignore her tantrum, when you ignore her meltdown, you let her know that you will not be affected by her behavior. You let her know that this type of behavior is not going to bother you or upset you. Ignoring a tantrum or an outburst can prevent it from growing further. You see, after the time passes and the child sees that she's not going to win, that you are unruffled, so to speak, her anger and outbursts will decrease. Yet keep this in mind. When you do ignore the behavior, make sure the child is safe. Don't walk away from the child in the middle of a store. Don't leave a child unattended in a room with items where she could hurt herself. Make sure she is safe when you ignore the behavior. When your car breaks down, what do? You go to a mechanic. When the air conditioning breaks in the middle of the summer, who do you call? An expert. If you have a toothache, where do you go? The dentist. These are trained professionals. They're trained professionals who also know how to help children. Trained professionals have a wide range of resources and tools to aid them as they help treat those who suffer with what might be ailing them in whatever fashion they might be. And there are many trained professionals who can help your child. Remember, you are not the expert at everything. You're not the expert at getting the car fixed, and that's okay. You're not the expert at getting the air conditioning fixed because you are never trained. You're not the expert at having teeth fixed because, again, you are not trained. And yet you accept that and you understand that. There is no embarrassment in calling a professional therapist to help you with your child. Because quite simply, they were trained with it and you are not. And that is no reflection upon you. As we've seen in other online training webinars, behavior therapy for young children can be a very effective way of helping children. Perhaps more than anything else, a child in foster care needs constant encouragement from you. Constant encouragement from you. Consistently praise him in all areas of his life and let him know that you understand completely and fully how difficult it might be for him to remain calm when he's angry, to stay in control when he's angry, and to model good behaviors at all times. When you see him staying calm, when you see him staying in control or struggling to do so, praise him for that. and look for the other opportunities to praise him and encourage him. At the same time, he needs to understand that you disapprove of his anger. Your disapproval is also important. Let the child know right away that this type of anger, this type of meltdown, this type of outburst is not okay. It is not acceptable and indeed can lead to additional trouble. Try saying things like, I am disappointed in your actions. I wish you had not done that. Many times, children are placed into foster care and they've never had any exposure whatsoever to consequences and the choices. Create consequences with a child when he throws tantrums. Talk about those consequences with him beforehand. Talk about the choice that he made to become angry, to have that outburst, to have that tantrum, whatever it may be. Remind him that there are consequences to every action. When he has that emotional meltdown, when he throws that object at you, when he screams at the neighbor, when he curses or swears at the teacher, whatever it may be, remind him there are consequences to those actions. At the same time, you still like and love him. Yet this behavior of his is not one that is acceptable in your household or in society. He needs you to help recognize signs. He needs you to help him recognize when he's becoming angry. When you see that he is beginning to become angry, help him to recognize this. Suggest some ways for him to resolve the problem by himself. Additionally, hugs and encouragement, or even remove him from the environment. All of this from you. Your hugs, your encouragement, helping him to leave in an environment that is upsetting him, these can be helpful for him. Help him come up with ways to remain calm. Help him discover opportunities that allow him to calm down and figure out how to best address the problem. When she is able, help her to try to communicate her feelings to you. Help her come up with solutions to help her calm down and de-escalate her anger. Talk to her about counting from 1 to 10 or 1 to 20. Talk to her about leaving a room when she's upsetting. Talk about how she can start breathing calmly. Talk about many opportunities for her to calm down. Ask her how she thinks she can solve her own problem. Help her become a problem solver when she is struggling with this. If you saw our online training webinar on discipline, then you are familiar with time-ins versus time-outs. We also discuss this at great length in the book The Foster Care Survival Guide. Time-in is a form of disciplining a child when issues of behavior occur. When a child is placed in time-in, the child is placed into closer proximity to you. You see, time-in allows the child to be near you or an adult instead of away, as time-out does. Now, what are the benefits? Well, example. During a time-in, a child might sit next to the parent on a couch or a chair while the parent reads a book to the child, or the two of them listen to soothing music together. This may help the child to calm down. During a time-in, a child might sit across from the table from the parent, and the two of them might work on a puzzle together, play a game together, while engaging in conversation. This can allow the child to calm down. During a time-in, a child might sit in a chair or a stool or even a throw rug while the parent goes about the daily household chores. Perhaps a parent is folding laundry in the bedroom, a never-ending chore for foster parents, to be sure. Maybe cooking dinner in the kitchen or cleaning the lounge room, and the child is simply near the adult, the parent. It allows the child to calm down. You might want to use charts and pictures when a child is angry to help the child calm down. much like this chart here. As we noted earlier, many children from foster care come from an environment that is not consistent in any way, and they need you to be consistent in all areas. This includes with your punishments and the consequences a child shall face when he becomes angry. A child in foster care, as we saw earlier, needs constant encouragement from you. Consistently praise him in all areas of his life. Let him know you understand how hard it might be to make good choices at times, and most importantly, find him in the act of being honest, find him in the act of keeping calm, find him in the act of doing the right thing, find him in the act of making good choices, and reward him in this. A reward might be, as we talk about in the online training webinar, it might be perhaps staying up 30 minutes later to watch an extra television show, or maybe a movie once a week, or maybe staying up later to read a book, or choose his own book, or maybe an ice cream cone, whatever it may be, but come up with some rewards and reward him for his good behavior. If a child has learned from his mistakes, he needs your forgiveness. He may have never been forgiven by a parental figure before. Your forgiveness is so very important to him. He needs to learn. He needs to understand. He needs to know without a shadow of a doubt that even though he might act out and make poor choices, that you still care for him and that you forgive him. Now, there are those times when medication might be necessary. You must always, always, always consult with your doctor and your child's caseworker, both, before giving the child any sort of medication for his behavior. We have an entire online training webinar about the importance of documentation. And indeed, documentation is so very important. 3 words: document, document, document. There are many ways you can document. There are many people you need to document for. But you need to be documenting your child's behavior when he becomes angry, what he became angry over, how long the outburst or the behavior lasted, what you did or how did you respond to this type of behavior, and how did he respond to your response or the consequences. Again, we go into this in great length in the online training webinar about documentation, and I encourage you to check out that online training webinar on documentation. Keep this in mind. You need to document the child's outbursts, his behavior, and all that occurs after it. For more online training webinars like this, check out the Foster Care Institute or just Google Dr. John DeGarmo. You can also follow me on Twitter and Facebook, and of course email me about questions about this webinar or other online training webinars at drjohndegarmo@gmail.com. And as we noted earlier, children in foster care will likely struggle in school and will likely have outbursts of anger from this constant struggle in school. The book Helping Foster Children in School, a guide for foster parents, social workers, and teachers is a must if you want to better manage your child's behavior and help your child to succeed in school. And of course, there are many other resources and books available for you at the Foster Care Institute as well. My friend, thank you so much for being part of this online training webinar. Thank you so much for caring for children in need. I know it can be challenging and frustrating and exhausting and confusing at times, yet what you are doing is so very important, not only to the life of this child, but for all of society. From the Foster Care Institute, I'm Dr. John DeGarmo. Thank you so very much.